And the coronavirus, it's not prejudiced or discriminatory at all. This is an N95 mask, right? This is like really hot in the street right now, very kind of highly coveted. So the reason that it's called an N95 is because it's supposed to block out greater than or equal to 95% of any debris or droplets that may come your way. So, you know, you can just go ahead and do that. Here is a surgeon's mask. So this is what surgeons actually use. My sister is a cancer surgeon, so you just go ahead or something, tie it for her, but you don't even get me started on that. But yeah, her assistants, which are a lot more competent than mine are and reliable, and her nurses and stuff. Regular one. These are the ones that I usually use in my practice, at least I did prior to the virus. So, you know, you just put it on like that. I mean, you know what masks are like. So I recommend these for everyone, okay? Whatever you can kind of get your hands on. An extreme shortage of PPE, which stands for personal protective equipment, that doctors like myself need to use in order to perform procedures. The fact that there are doctors and nurses and like others seeing patients and like doing exams on COVID-19 patients without PPE is like mind-boggling, really, and it's just extremely freaking dangerous. I was watching on CNN that a few doctors in New York have died as well, like I mentioned. So to those who have stolen PPE, I mean, like, I obviously I have to kind of maintain my composure, but I mean, it's like, that's just like beyond like low. Like you're like, if you're doing that, like, honestly, you're like the lowest of the low. You're like beyond trash. Like, I'm sorry. I don't care. Like it's just abhorrent. It's incorrigible. Like, just don't be an idiot. Seriously. Like, doctors are the ones who have to help you, right? So you need to do whatever you can to like keep us safe so that we can actually work properly. You have symptoms or are sick, stay inside and stay the hell away from other people, okay? You don't have to panic, but you need to be vigilant. So with the proper precautions, you will likely be okay. Symptoms tend to show after about 2 weeks, which means you may have the virus and not know. It's the part that's most unsettling for everyone, including myself. The greatest symptoms are fever, shortness of breath, dry cough, and also loss of taste. So if you have symptoms, definitely call your primary doctor, your PA, your nurse, and have them try to order a test. I know, easier said than done. I'm going to talk about testing in another video. So quarantine or self-isolation, okay? This is very important. So if you have any of the above mentioned symptoms, stay the hell away from people, okay? Seriously, like for example, like if you had a bad cold or like a fever or like a cough or something, you wouldn't be like going around your loved ones and your friends and family, like blowing your nose and like sneezing all over the place, right? So this situation is like exponentially worse, right? This condition is like exponentially worse. So just, act the same like how you would if you were sick normally, basically. I think that's kind of very simply stated. The thing is, again, like if you're sick or you have symptoms, just practice quarantine, stay home. If you want to go to the park to be active, that's fine. If you need to go to the grocery store, okay. But just stay away from people when you're there, right? Wear a mask, like keep your distance, wear gloves, hopefully everything will be okay. So this is really important, and a lot of this information is going to come from like myself, just as a practicing doctor, information that I've kind of just like gained over time. So acetaminophen or Tylenol is good to have on hand just to like keep your fever under control. Some sort of cough medicine, whether it's like Robitussin, Dayquil, or NyQuil, that's certainly going to be helpful as well. Ibuprofen or Advil for any potential pain. World Health Organization actually advised against taking ibuprofen because they said that, it may have some correlation to like the virus or like kind of not like perpetuating it, but basically they advise against it. But then on March 18th, they sent out a tweet that they retracted that statement. Like myself, who performs surgery regularly, I prescribe ibuprofen after surgery all the time, unless the patient is allergic to NSAIDs, then I don't. French officials recommended taking paracetamol, which is a pain and fever reducer. The thing with that though, it's, you need to get a prescription for it. It's not widely available. Like ibuprofen you can get at Dollar Tree, acetaminophen you can get like, also very cheap, right? Which is very important. Like, trust me, I know finances are like a huge issue right now. Like, I mean, even I myself am very concerned about, money and stuff like that right now. But paracetamol is that like, it has to be taken very, like a lot more carefully. I personally have never prescribed it. If people like it, like that's fine. I guess if you're interested in it, then you should just ask your PCP or your primary care provider to prescribe that for you. So with my patients taking ibuprofen, I generally recommend like 400 to 600 milligrams every 4 to 6 hours, or every 6 hours, excuse me. Just don't exceed more than 3,000 milligrams per day. I perform like major oral surgery, and that usually kind of does just enough for my patients. So yeah, it's like I do that rather than putting them on like, a painkiller, an opioid or whatever. Avoid cold beverages right now, which is tough for me personally because I'm very conscious of my teeth and, I want them to stay bright and white. So I drink cold brew. Like I drink cold brew like every morning. But the thing is that this, the coronavirus, it likes to kind of live in your throat and in your larynx. So it's better. I would recommend drinking like hot beverages right now. So like tea, coffee. I actually had coffee earlier. I just like went through the drive-through because I just like it's like cold here in Chicago, and I just kind of wanted to like wake up and just kind of wanted to feel like warm inside. So that's why I got that. And yeah, if you drink like a hot beverage, like this will kind of help combat, like the coronavirus if it's kind of in your throat. Don't smoke, obviously, dummy if you do, and don't smoke hookah either. Like, don't think that that's like he said don't smoke. No, none of that stuff, okay? So for my Muslim, Indian, Pakistani, and Middle Eastern brothers and sisters, I know that this is particularly tough since this tends to be the social practice of choice for us, but you got to lay off it, bottom line. And like, none of that vaping and none of that stuff. Like I don't know about all that because that's like, it's just some other stuff, but yeah, whatever. It's like exploding in people's faces. So patients I was seeing prior, I would spray hydrogen peroxide. So you just like, I would spray it in their throat, like in the back, and then I would keep it in there for like, about 5 minutes. And the reason that I would do that is just to like kill any bacteria or anything that was like, it's not, it doesn't taste good, but it's not like horrible. Oh, it's not great. Yeah, but like, when I was seeing my patients, like I would just spray that in their mouth, and then it just kind of like clears, it just kind of like kills anything that's there, and then, suction or whatever. This video is kind of long, was a lot of information. I really hope that, you kind of got something out of this video, and that it helps you. Bottom line, just like be safe, like take care. I know this like virus, it's really scary. It's scary for everyone, including myself, my family, and I'm going to talk about that in like some other videos that I have. So this is just kind of like the beginning of my coronavirus series for my channel, Perspective with Dr. Shah-Khan. But let me know what you guys like, what you want to hear more about, and we'll definitely hopefully like address that for you. Just put it in the comments, but make sure to subscribe, like, comment, hit the bell notification, and I will see you next time, okay?